Hi, I'm Rohrich. Welcome back to Rohrich Knows Podcast, helping you become a better you and a more informed you and actually a better looking you. So we're here today with Miss Clifton, Dr. Miss Clifton, and tell me a little bit about what you're doing. She's a world famous dermatologist in Bentonville, Arkansas. She's got a huge practice, and she's going to tell us about her preference on the use of skin resurfacing devices. I mean, there's such an array. There's so much confusion out there, Missy, about, what should I use? I mean, when and what works best for me? So how do you approach patients that have all these issues? And, people say, I want microneedling, I want radio frequency microneedling. Tell us about how do you clear up that confusion when you see a patient? How do you decide what they need that's best for them?
Well, it's really interesting. And so many patients are so incredibly confused. It's kind of like going to Sephora and trying to pick out any kind of product for yourself.
Right.
Because there are just so many millions of options out there these days. And so many different devices that are made by different companies that do similar things
Right.
that are advertising to the public. So it's just patients are a little overwhelmed.
Right.
So when patients come in and say, I want this, I say, okay, let's take a step back. Let's see what bothers you.
Right.
What are you trying to address?
Great.
Because very often people will come in and they will say, I have this skin laxity on my cheek,
Right.
And I want Botox there. And I'm like, well, Botox is not going to work there because that's not because of muscle movement that you have that line. So you sort of have to see what the patient's looking for,
Right.
and then direct them down the right channel. So a lot of younger patients are coming into me now because they're just barely starting to see some textural changes of
Right.
the skin, maybe some pigment changes of the skin, and they want to start doing something to kind of reverse those things. So in the vast majority of younger patients, I say, a lot of times microneedling is great, especially if they have acne scars and they're trying to improve just the texture and tone of their skin and rebuild some collagen a little bit. I love microneedling for those patients. For people that have some hyperpigmentation, maybe melasma, I love some of the milder or medium depth chemical peels.
Mm-hmm.
But then some people come into me and they've got a lot more sun damage and deeper lines and wrinkles. And for those people, you kind of have to step it up a little bit.
Right.
Sometimes you'll add the energy-based microneedlings, like the microneedling with radio frequency. And there's a lot of devices out there that do that. But when you add that energy-based stimulation of collagen to just the traumatic kind of research or rebuilding of collagen, you get a lot more skin tightening.
Right.
So you can get better results over time. And then deeper depth chemical peels for some of those people. And then sometimes we need to get into some milder laser resurfacing, depending on what level we need to go to.
So that's
and
kind of that's kind of the graduated approach from like microneedling to the radio frequency to chemical to I agree. And so
yeah. And then for probably the patients that we treat, they've had a lot of skin cancer, ton of sun damage, really, laxity, that kind of thing. Those are the patients that we're going to really do even sometimes a combination of the radio frequency microneedling to get some of the tightening of the skin, and then also the resurfacing, sometimes even full face erbium resurfacing to really remove a lot of that damage and hopefully prevent them from having skin cancer down the road, but really eliminate or minimize a lot of the deeper lines and wrinkles too.
So when do you add, this is all skin resurfacing things, so when do you do concomitant fillers or at the same time, or what do you do? Because I know many times when I'm in the operating room, especially for the deep ones, I actually add fat, which is obviously,
right.
I think, a great filler. But
great option if you have it.
If you're in the operating room. So what do you do for your patients if you're going to go deep, like into the laser? When do you add fillers or not?
So I will say usually fillers and neurotoxins, it kind of depends on the severity of what we're looking at. A lot of my patients, if they just need some milder, resurfacing and a little tightening, we can kind of do the filler and neurotoxin first, and a few months later do
Right.
those procedures because they're not really going deep enough to,
Right.
to really manipulate the filler. If someone really needs deeper, treatment, then I like to do those deeper laser or radio frequency treatments first. Really get them that skin tightening the
Right.
best we can get, and then the neurotoxins and the fillers are really kind of like the icing on the cake. They're the thing that we just, we really give you that finishing touch and really used more for maintenance once we kind of eliminate a lot of that damage.
Right. And all of these treatments, there are a series of them. You have a series of microneedling, a series of radio frequency, right? And then except for the deeper lasers, I mean, sometimes that's pretty, and the recovery time, obviously, for the deeper you go, the more the recovery time. So, I mean, it's kind of
Correct.
the price you pay, right?
Yep. Some of us are really paying for that baby oil and iodine that we did back when we were, in our teenage years. And in the South, boy, oh boy, did we do that. But yeah, I tell patients, you know what? You didn't get your skin in this condition overnight. We're not going to reverse it overnight. And, it's a combination of, not being, careful in the sun, maybe not being super healthy. Maybe you drink too much or you smoke too much or, you've done some of these other things. And, we have to do a multimodal, kind of repair for the multimodal damage that you caused.
Yeah. So what about, and it is a little divergent, but okay, so the patient says, okay, I want to do that, but in the meantime, what are the top 3 things I can do with my skin care that will help me during this process? I mean, obviously sunscreen is always number one, but
Absolutely. So I would say that homework is super important. If you're going to spend money in the practice, if you're not going to take care of your skin at home, you're really doing yourself a disservice and your pocketbook a disservice. So I would say number 1, correct, a sunscreen, and I prefer sunscreens that have zinc oxide or titanium dioxide as the active ingredients because they are much more broad spectrum. They're super safe. They're not going to cause allergies and things like that to some of the chemical sunscreens that a lot of people can get.
Can you give us like a couple of brands that are good? I mean, when I'm just that you like.
So I love Elta MD because it's a great price point. My favorite sunscreen on the planet is made by a company called Pavis.
Yes, we have
it is this really amazing scientist named Sophie Bai, who is probably one of the more brilliant people I've ever met. And she's created a sunblock that lasts
12
throughout
hours.
the day, but also has lots of antioxidants and things that reverse damage. But there are lots of great sunscreens out there, but the key is to really look for something that has zinc oxide or titanium dioxide as the active ingredient. Those are the best places to start. And then I believe that most people need to be on a retinoid, some sort of retinol or retinoid containing product that needs to be at night because retinoids are broken down by sunlight. That's a mistake that some people make. And a lot of the retinoid containing products you do have to gradually kind of ease into.
Right.
One of my favorites, I'll throw it out there, is made by Revision, and it's called DEJ Night because it has not only the retinol that is micronized and gradually released, it has bakuchiol. That's one of my favorite words to say, bakuchiol, because it's anti-inflammatory, so it calms down the redness and irritation that you get from the retinol. And it's also great for repairing the skin. So I love that. And then, I would say in the middle there's antioxidants and peptides and serums that are
Vitamin
just
C.
helping your body kind of reverse the damage that's been done. And there's lots of different products out there. There's, really, really good ones, depending on what you're trying to address.
No, I agree. I love Revision Skincare. We carry that entire line because it's science-based, and I love science-based skincare. Pravisa is great. We've been carrying that very recently. I love it. It's kind of all in one, and it truly does last 12 hours. It's brilliant, actually.
It's pretty amazing.
It's pretty amazing. It's a little higher cost point, but it's brilliant. It's your skin. So
you do get what you pay for with some of these.
It's like a lot of things in life, right? So
that's absolutely true.
So I love how you've cleared it up for us on when to use what and where. So for the viewer, when they want to go and find how to best treat their skin, what are like your top 3 things that they need to know when they're trying to find someone whether they need microneedling or a laser? what should they do? Obviously, be finding a skilled dermatologist or plastic surgeon that really understands it, is an expert in this, not just has a spa and doesn't even know, or oversee it, right?
Correct. So I would say that the vast majority of us that are really, dealing with patients on a day-to-day basis that are really doing it well. I think you need to have someone that has an imaging system that can come in and really look at your skin without makeup and really give you an idea of the level of your damage and what we're looking at and really the overall health and quality of your skin. And you need someone that's going to partner with you and to really help you make that plan for yourself, and then assess how you're doing down the road, because it's really a partnership. We're not going to put you in a bubble. And even if I do a really big resurfacing procedure, if you're not doing your homework and preventing the aging process over time, you're going to be right back in the same boat. So the main key is to find someone that's really going to partner with you, that's really going to evaluate your skin individually and give you an individual and customized plan and continue to walk the path with you.
Well, I love that. And you can hear and see and feel the passion of Dr. Clifton. And I think that's the kind of person, practitioner you want to be associated with, that's going to oversee and be part of you being your best you. So thank you so much, Missy, for sharing that wisdom with us. So helping you become a better you, and give us your thoughts and comments, and we'll look forward to seeing you next time. Thank you.